Okay. Well, hello, community. I am with Dr. Deanna Robinson with, I believe it's our, my goodness, Ego Integrity Counseling and Wellness in Marshall, Texas. And we are so excited about her being with us tonight. Tonight, we're going to be discussing the signs of mental health and being suicidal. So I am so grateful that you took the time out. She just come from her daughter's game to be with us tonight. So that's a huge sacrifice. So we want to definitely just salute you for taking the time out to be with us. So I'll let you get started. I will just listen if I have questions, but tonight I'm here to learn and grow. So thank you.
Well, good afternoon, everyone. Christina, thank you so much for the opportunity. And I am slowly waiting on my PowerPoint to load up. It is loading up. Okay. Is there any way for me to share my screen?
I hope so.
I think I got it. Oh, it says you disabled it. Okay.
Okay, hold on just a second. What about now?
All right, there we go.
Okay, awesome.
Okay. Yeah, just, oh, there it is. It went to the corner. Okay. Okay. So, all right. So like I said, we said we're going to be talking about suicide awareness and prevention. So first I wanted to differentiate between suicide, suicidal ideations, and then of course, suicidal behavior. We all know suicide is the act of ending one's own life. Suicidal ideations are the thoughts that one may have about harming themselves or self-harm. And then suicide behavior are the tendencies and of course the behaviors that one may engage in prior to attempting to complete suicide. So some statistics, I always find that it's good to start out with some statistics to really put a topic in focus. So in 2020, statistics show that suicide was the second leading cause of death for youth ages 10 to 25 and adults from 25 to 34.
Wow.
Right? So it ranks up there pretty high. So that means that, it is becoming a potential crisis. Now, among ages 15 to 24, it was the third leading cause of death. Okay. And then as individuals get older, it becomes less and less. So this is showing that more younger people are completing suicide. Okay. When it comes to completed suicides, boys are 4 times more likely than girls to complete the suicide attempt. However, girls are more likely to attempt than the boys. Okay. The method of choice when a teen decides to complete suicide, they use guns. Guns is used in over half, followed by overdose.
Wow.
And then hanging. All right. So when we look at what may cause a teen to even have thoughts or plans to even attempt to commit suicide, we look at what causes it, what's been going on in their life. As a therapist, when we are engaging with a teenager or even an adult that is considering harming themselves, we look and assess what is going on in that individual's life. What have they experienced recently? So as far as teens go, if there's been any changes in family, like are their parents divorcing? Have they moved to a new town? That can be considered a traumatic event for a teenager, to be in one area and then have to move to a completely different area and leave their friends and their acquaintances and their support system and network. So that can trigger thoughts of depression, which can potentially lead to suicide attempts. Look at changes in friendships. As a teen, teenagers have more access to social media and internet. So a lot of times, they may have experienced something and it gets posted on the internet, or they're no longer friends with someone they've been friends with for forever due to them hanging with different crowds or them engaging in various acts. Okay. Problems in school. A straight A student goes, to a straight C, D, or even F. Are they having behavioral problems in school? And that can be combined with them experiencing changes within their family dynamics, moving, changes in friendship. Okay. Then other losses, have they recently lost someone that was important to them, either through natural causes or through suicide themselves? That can cause a teenager to contemplate harming themselves. And then lastly, bullying. We've talked a lot about bullying in the community and how it is rising to be a social problem because of the negative outcomes that occur from the bullying. So those are things. These are just some of the things that can cause a teen to contemplate harming themselves. Okay. Now there probably are other things, but these are the main ones that have been identified by clinicians. Okay. So there are certain risk factors. So once we've identified, any recent changes that have been going on in their lives that, may put them at a higher risk, then we actually look at risk factors. Now, risk factors are not like, what am I trying to say? They're individualistic and they vary based on the person. So what may be something that could trigger me may not trigger you, Christina, and so on and so forth, because we have different lives, we have different systems that we support systems in different communities and so many different variables. So that again boils down to age, gender, cultural identity, maybe social influences. So one of the most prevalent risk factors is, okay, does the teen have a history of mental health problems themselves? Okay. Or are they engaging in substance use? Okay. All right. Is a teen impulsive? Like, do they just act out or they don't think about consequences for their behaviors? They're impulsive, and I know that as teens, the brains are still developing and some may not have a concept, but when we talk about impulsive, it's just like they really don't think about anything. They just act or they react or they just do whatever they want to without any thoughts of the consequences, like I stated. So impulsive behaviors. Okay. Undesirable life events, divorce, loss of parents, loss to a support, loss of a friend, Now, family history of substance or mental health problems also, and also family history of suicide attempts, whether completed or not, are risk factors. A history of family violence, trauma, abuse, neglect increases the risk. Has a teen themselves had a prior attempt? Guns in the home, or even access to the means to complete suicide. Recent imprisonment or exposure to the suicidal behavior of others. Okay. So if a teen has experienced a, a recent change or loss, and they have several of the risk factors, more often than not, you will be able to see some of these warning signs. Okay. And these warning signs, in addition to the increased risk factors, are always suggestive. Now, it's not an exact science, but if all of this is mounting and you're seeing, okay, my teen or someone I know has a lot of these risk factors, look for some of the warning signs, such as changes in eating and sleeping habits. Are they not sleeping? Are they sleeping too much? What is their appetite? If this kid used to have a healthy appetite and now they're no longer eating, something may be going on. Okay. They aren't in participating in like usual activities, like the athlete who's no longer interested or doesn't want to participate in sports or band or any extracurricular activity. Like, do they no longer have the interest to participate? Have they withdrawn from spending time with family and friends? Running away, engaging in alcohol or drug abuse, any kind of substance use. Okay. Personal appearance, like, I know with my teens, they wear these hoodies and these shorts, and I don't understand it. But what it means by that is that, they don't want to bathe. They don't want to wash their hair. They don't want to brush their teeth. Like, they have total disregard for what they look like, smell like. Right. They just don't care. Okay. Right. So that would suggest that something more is going on. Again, with the impulsivity that we talked about, they're taking unnecessary risks. Okay. Are they spending a lot of time talking, thinking, contemplating about dying or death? A lot of times mental health can manifest itself into physical symptoms. Okay. Like, do they have headaches, stomach aches, tired, these can be related not only to something physical going on, but also changes in their mental health. Loss of interest in school, okay, being bored, and of course, problem focusing. Right. So what are some things to look for, also to look for in a teen who may be considering harming themselves? If they make statements that they want to harm themselves, that they are contemplating committing suicide. If a teen, whether it's your child or whether it's a friend or someone that you know, if they make statements about wanting to harm themselves, you should take all statements seriously. Don't say, oh, they're just saying. No, you take all statements seriously, and you make steps to get them either to their primary care doctor or refer them to a mental health professional for further evaluation. Okay. Giving verbal hints, dropping statements again, doing just saying random things. I know from a lot of the research that I was able to read about friends and families of loved ones who had completed their suicide attempt, they looked back and they reflected over these signs and they realized that their loved one did exhibit a lot of these signs, but they didn't look for them. Mm-hmm. Or they weren't recognizing them until after the fact. One of the key elements in combating teen suicide is being aware of your child, their patterns. And if something is off with your child, investigate. Okay. Another thing is they start giving away their favorite possessions or their prized belongings,
Wow.
Maybe your teen has been experiencing a lot of depressive symptoms like loss of interest, poor appetite, being tired, having thoughts that life isn't worth living anymore. Okay. So, but after a period of depression, they get cheerful. Okay. Expressing weird thoughts. And again, you know your child better than anyone. So if they start acting outside of their normal, investigate. Okay. Don't just be like, oh, okay, they're just going through a phase. Especially if you know that they are experiencing some of these risk factors that we've talked about, And then lastly, signs, they write a note. Okay. In a lot of the cases, some write notes, some don't. Okay. But always, if any of these signs are evident, again, do something. Okay. Right. So if a teen does express wanting to harm themselves, there are various treatments, various levels, okay? The first one would be individual therapy, in which the teen and a therapist work together to come up with a plan to understand and identify, what's triggering it, what causes it, and then of course help them to identify coping strategies for when they have these thoughts, what they can do to minimize the percentage or the probability of them attempting to harm themselves. Okay. Next is family therapy. Now, family therapy involves not only the teen, but the whole support system. Everyone that is close to that teen going to therapy, because family is a big component of a teen's life. Okay. And when they are not getting the support that they need from their family therapy helps to understand the systems within that family system and where is the breakdown and what they can do to strengthen those bonds and ties to help that teen. Wow. And then finally, in the most severe cases, is inpatient hospitalization, which means the teen goes to an inpatient treatment facility where they are closely monitored. A lot of times they're put on medication, and they get therapy there, and it's usually a short-term stay, depending on what happens when they're in that hospital. Average stays 7 days, 10 days, but again, it depends on what happens once that teen goes into that hospital.
Wow.
All right. So if you feel that your teen or a teen that you know that you are involved with, that you have some kind of interaction or you support them, if you feel that they're at a high risk, okay, or they talked about it, again, you're going to take all statements as serious, okay? So that means keeping medications and guns away from teens, okay? Getting the teen help, okay? Whether that is individual, family, or inpatient hospitalization, getting them some kind of help, okay? Because the problem is not going to go away on its own. It's just not going to disappear. Okay, we have to do something. Okay. Next, support the teen. That I know as parents, we'd like to criticize what our kids do and who they are with and all of that. But during this time, be supportive, okay? And of course, stay involved. Don't let that, with teenagers, they kind of want to put their parents off, but you stay on that kid. You stay connected with them. You stay involved with them. You show them that you are supporting them and you are there for them. Okay. Become informed. Attend, meetings such as this. There's resources online available at libraries. I don't know if there's any support groups for this particular topic, but that may be something that we can look into, is having a support group for friends and family. Knowledge, so know and understand the different warning signs, okay? And don't be afraid to reach out. If you're a teen, or again a teen that you are involved with, get that teen some help. There's nothing wrong with getting help. And we'll talk about stigma, which is something I want to talk about next. Okay. And finally, you're going to treat all instances seriously. Okay.
Wow.
So next, I wanted to talk about stigma. And stigma is something that is very real, especially down in the East Texas area. What I found, there's a lot of stigma that's still tied to mental health. Okay. Negative attitude that others have as to mental health or mental illness. Okay. Studies have shown that over half of people who live in rural communities, which is what East Texas is predominantly made of. We don't have any major cities. We're not the metroplex, okay? So over half of the people identify stigma as a barrier, which means they aren't getting the care and the support that they need for their mental health needs because they're afraid of the stigma that is attached to getting support and treatment, okay?
Wow.
So what is an example of mental health stigma? Just simply incompetent. I'm going to see a therapist and, people turn their nose up at them or they instantly think that something is wrong with them.
Yeah.
So the problem with stigma is that it causes the individual who needs it turn